It's important to know the different positions that your baby can be in during pregnancy and during labor. And it's also important to note that your baby's position during pregnancy does not indicate when you'll go into labor or even how your labor will go. The first thing is going to be, most babies are going to be head down. If your baby is not head down, they might be breech, where their butt is presenting first, maybe one leg is presenting, or maybe they're curled up in a little cannonball. If your baby is not head down, they could be breech, which means their butt is presenting first. This could be problematic during pregnancy depending on the types of options that you have when it comes to your birth, as vaginal breech birth is not commonly an option that's presented to folks. And so you may be only looking at a scheduled C-section or looking at some options to help your baby flip head down. If your baby is breech, it could be really important to have a conversation with your provider on the options that are available to you. And if you're not satisfied with those options, finding another provider that does give you the options that you are seeking. Another position that your baby can be in is transverse lie, which means that they're laying sideways in the pelvis, which can be problematic because it makes it really hard for the baby to be born vaginally, and this would have to be a C-section. Usually, though, these babies will rotate to head down or they'll rotate to breech, where you would have an option for a vaginal birth. Now, if your baby is head down, which is the most common position, we can look at the back of their head in reference to your pelvis to determine what their position is. So if the back of their head is towards the back of your body, they're known as occiput posterior, which means they're in OP position, sometimes known as sunny side up. If they are the opposite, where their back of the head is towards the front of your pelvis, they're going to be occiput anterior, or OA. If they're towards either hip, they're going to be known as occiput transverse, which is different than transverse lie. This means that baby is head down, but the back of their head is towards one hip. If they're towards the right, they're going to be right occiput transverse, or ROT. If the back of their head is towards the left hip, they're going to be left occiput transverse, or LOT. Now, we also have our diagonal positions, which are kind of in between the OAs, the OPs, and the OTs. So if baby's a little bit to the left to the front, they're going to be known as LOA. If they're a little bit to the back to the left, they're going to be LOP, or left occiput posterior. Now, on the right side, we have our ROP, right occiput posterior, and then ROA, right occiput anterior. And so it's important to know the acronym names of baby's positions because those are usually the ones that you're going to hear. So if baby's to the front, OA positions. If baby's to the back, OP positions. And then towards either hip is going to be an OT. And then we add either the left or the right side. To help determine what your baby's position is, we're going to use the back of their head as our reference point. So this is known as the occiput of the baby in reference to your pelvis. So if the back of the head is towards the back of your pelvis, they're OP. If the back of the head is towards the front, they're OA. OTs are going to be towards either hip, and then we have our diagonal positions. It's important to note what position your baby is in because different positions are going to correspond to different pelvic levels. And certain positions are going to be a little bit better depending on the pelvic level that your baby is navigating through.